Gentlemen and ladies, we have been looking at the electrical function of the heart, the way we assess the mechanical function of the heart, looking at the cardiac output, ejection fraction, stroke volume, and all those things, all those parameters. We are assessing electrical activity of the heart by looking at the electrocardiogram, what is called the ECG. So this is a machine that is connected to a client or subject's body, and it picks electrical activity through leads and traces these electrical activities on a sheet of paper. And then the recordings are such that the machine records the electrical activity within the heart, and the standard ECG machine has lead wires that are attached to a patient and produces the electrical tracing. So this will be the ECG machine, and new ones are now even more portable, and then they are connected to the patient like that. So what would be the need for, or the use for ECG? Is that it's useful to check for problems with flow of electricity through the heart. It is also important to be used for diagnosis of changes in the heart rhythm. It is also very useful to monitor or evaluate the individual with heart conditions. So this is a normal standard wave and segments of the ECG to show normal heart rhythm, what is also called the sinus rhythm. So we have waves that are alphabetically named. So we have P, Q, R, S, T, U waves. Okay. So normally we will only end at T wave. In some people there will also be the U wave. So we have the P wave is a wave of electricity produced by atrial depolarization. And remember, atrial depolarization is as a result of the firing of action potentials from the sinoatrial node. Therefore, if the sinoatrial node is working just fine, then we should always have a P wave on the ECG. Then it means the heart is being paced by the sinoatrial node. Therefore, the rhythm of the heart is referred to as the sinus rhythm. Then after the P wave, we have the QRS complex, a combination of QRS waves. Now, this wave of electricity, this complex is depicting the depolarization of the ventricles that take place after the atria have actually depolarized and they are going into relaxation. Then the ventricles begin to depolarize. Then the relaxation of the ventricles is picked by the T wave going into the U wave. So this is the normal ECG tracing. So what information can we get from the ECG? The rhythm of the heart and the heart rate, so we can actually count the number of P's in a minute, and that will be our heart rate, or the number of R's in the minute, and that will be our heart rate. The size of the chambers, the atria and the ventricles, also myocardial blood flow, because reduced blood flow or ischemia or death of portions of tissues, which is infarction, can actually disturb the electrical waves of the ECG, and so that can show us some changes that would be useful in determining electrical activity of the heart. Then arrhythmias, these are abnormal heart rhythms where we have tachycardia, which is the heart rate above 100, bradycardia, which is heart rate moving towards 60, going downwards, and then specific arrhythmias can also be present where we have premature beats. These will be beats that are not normal, and they are likely to be originating from ectopic sources that are not normal. The normal source of the heart rhythm is supposed to be sinoatrial node. But if there is dead tissue, there will be a lot of potassium that is released around that cardiac space. Therefore, those cells there become very sensitive, and they can also produce action potentials that can disturb electrical activity. Atrial fibrillation, these usually are supraventricular tachycardia relating to the atria and the fibrillation relates to the fact that the heart rate for the atria is too high, beyond 100, going to the 200s. Ventricular tachycardia, these are um, tachycardias related to the ventricles, and the ventricles are beating at abnormally high rate. This is where we end, and look forward to blood flow and blood pressure discussions.